Thank you and good morning. So for today, as mentioned, we're going to be sharing our latest modeling data and epidemiologic data for the pandemic as it is in BC. And then this afternoon, we'll have a statement with today's numbers. So what we are going to talk about this morning is, again, how and where the virus has affected people in British Columbia. To start off with, geographically, this is the distribution of where cases are by health service delivery area. So updated on the left is the cumulative totals since the pandemic started last year, and on the right, the past 7 days. And as we can see from this, we have had ongoing transmission in areas that have not previously been heavily affected in British Columbia, particularly in the north and the interior of BC. And as we have had more cases, we have presented data at a more granular level. And this is the data, the geographic distribution of our cases by local health area of residence. And by convention, we always present the data by where people live. And that's what we have done from the beginning. And of course, across Canada, we do that the same way. So that does not always reflect where people have been exposed to the virus or become infected. But by local health area, now that we have increased numbers of cases in our local health areas, we can present this data more frequently without risking re-identification of individuals. This tells us that there has been no area of the province that has been spared from this virus. And in the last 2 weeks, we have seen spread particularly in areas that have not yet seen such spread in communities in the interior and the north in particular. And on a positive note, we've seen decreased activity in some of the hard-hit areas early on, particularly in the Fraser Health region in the Surrey area. This is the profile of our cases over the last couple of weeks. We've had 3,000 new cases this week and 108 people newly hospitalized. As you can see, our epidemic curve increased and peaked in November. It has come down. We did see a bit of a blip again early in January related to transmission over the holidays. And we've now flattened and slowly started to decrease. This is the same information presented by the date of the lab test or report, and it goes back only to the summer, but it shows the progress that we've had in our second wave of the pandemic here in British Columbia. Again, the majority of cases happen in the Fraser Health region, but what we've seen more recently is a steady decreasing in Fraser Health, which is really great news, but an increasing in some of the other health authorities, particularly the interior and the north, and also what we're seeing in Vancouver Coastal most recently has also increased, and that is we're seeing more cases in areas like Whistler and in the North Shore Coast Garibaldi region of Vancouver Coastal Health.